Now we shall be moving on to the healthcare system in the rural area and the urban area especially, basically, right? So let me just start with the rural area, right? Actually, this is actually coming under the National Rural Health Care, right, or National Rural Health Mission. So from the government side, they are actually they had actually introduced this National Rural Health Mission, and National Urban Health Mission came after that. So National Rural Health Mission. So this is the NRHM. Under this National Rural Health Mission, the same things we are talking about, like that there is a village level, then Asha is working over there, then there is a sub-center, then there is a primary healthcare center, community healthcare center, like that. So in the village level itself, guys, let me just brief it very fast over here. At the village level, what we are talking about? At the village level, basically, how many population? We are talking about 1,000 population. Okay, so be very fast with me. 1,000 population, right? Who is working over there? Asha worker. Who is working over there? Asha worker. Right? Very nice. At the village level, are we talking about some bed available over there? No, there are usually no bed, right? So the beds are not there usually. Okay, the beds are not there usually, right? Okay, one thing is clear. Now let's move on to the next point over here. Okay, so village is done. Okay, these many things you need to remember about the village, right? Second one is your, after the village, what you are having? Sub-center. After the village, what you are having? Sub-center. So let's talk about that. So what facilities are present at the level of sub-center, right? If they're talking about how many people they're actually handling at the sub-center, so how many people? I told you 5 to 6 villages, okay, or it might vary somewhere. So over here usually we are saying that at the plain area, in the plain areas 5,000 population, at the hilly areas or at the tribal areas or in the forest areas there could be the 3,000 population, right? So in the plain areas and in the tribal areas, okay, areas, so there could be the areas, right? So there could be some fluctuation, but usually they are saying at the plain area they are handling about 5,000 people, and at the tribal area, hilly area, forest area, or these kind of areas, they are actually handling about 3,000 number of people. Okay. Now, if they talk about who is actually working over there, these are the multi-purpose worker or ANM. Okay, ANM, auxiliary nurse midwifery. Okay, so ANM and these kind of things are working over there. So ANM worker, ANM is there, and the multi-purpose worker, MPW is multi-purpose worker, are working over there, right? How many beds we are talking about? 0 to 3 beds might be present over there at this level. 0 to 3 beds might be available at this particular level. Okay. Now, third one over here is after the sub-center, then there could be the primary healthcare center, right? After the sub-center we have talked about, there could be the primary healthcare center. At the level of PHC, right? At the level of PHC, what we shall talk about over here. So at the level of primary healthcare center, PHC, right? How many people they are handling? This is much bigger level as compared to the sub-center and the village. So over here, we are actually catering to around, in the tribal areas or the hilly areas, forest areas, that is different. In the plain area, that is different. If we talk about in the plain areas, right? In the plain areas, they are actually catering for around 30,000 people, 30,000 population, and for the tribal areas, it could be around 20,000 people. For the tribal areas, it could be around 20,000 people, right? 20,000 population or 20,000 people. Who is actually working at that point of time? There are much people, right? There are many people. For example, I told you over here, medical officers might be there, right? Here, actually, we are talking about different levels of medical officers might be there. So let me just talk about them. So actually, 3 medical officers should be there, right? In the 3 medical officer, I am not saying all of those 3 doctors are MBBS doctor. It's not like that. One MBBS doctor would be there. Okay, along with that, that will be the MO in charge. Okay, so if you are a doctor over there, you will be the in charge, right? If you are working in the primary healthcare center, right? So 3 MOs could be there. So one will be the MO in charge, right? One will be the MO in charge over here. Okay, one MO will be the in charge over here. That will be the MBBS doctor, right? Then there could be the MO medical officer from the Ayush department. So Ayush MO would be there, and one from the dental department. So MO from Ayush, right? Ayurveda, and one from the dental. Okay. So 3 MOs might be present over there at the level of PHC. After that, there could be the A&M also. There could be the A&M also. With that, A&M might be present over there. Okay. Along with that, there could be the pharmacist. There could be the other health worker, assistant, and the health workers over there. So A&M could be there. Then health workers could be there. Okay. And health assistants could be there. Health assistants could be there. Okay. With that, pharmacist could be there to provide the medications and all, right? Whatever medication you are writing, who will be providing that? Who will be providing that? That will be your pharmacist only, right? So these many people might be working at the level of PSC. So it's kind of a bigger level, right? Obviously, if you're talking about bed, yes, there are the availability of bed as well. For about 4 to 6 beds might be available at this particular level, right? Then we shall talk about the fourth one. We shall talk about the fourth one, and that is the CHC level. Okay, so let's talk about the fourth one, that is the CHC level. Over here, we are talking about much bigger level than PHC now. So here, fourth one would be the CHC, that is the Community Healthcare Center, right? Community Health Center. And over here, we shall talk about the population which they are catering, that is a much bigger level. In the plain areas, they are catering for around 1,20,000 people. So, right, in the plain areas, if I talk about, there, and in the tribal or hilly areas or the forest areas, right, these kind of areas, in the plain areas, they are actually catering for about 1,20,000 people, right, because it's a bigger level as compared to the PSC village or subcenter, right? And the tribal areas, they are catering for about 80,000 population. Okay, if you talk about the the workers who are present over there, so many workers. So guys, over here we are talking about the specialist. Okay, yes, doctors would be there, but specialists will also be there. In the specialist category, we shall talk about your, there could be the medicine doctor, internal medicine, MD medicine doctor, right? Then there could be the surgeon present over there. Then there could be the OBGY doctor, right? Then there could be the ophthalmologist present over there. Ophthalmologist might be present over there, should be present over there. Pediatrician should be present over there. Right? And along with that, okay, anesthetist also might be present, must be present over there. Anesthetist also should be present over there, right? Along with that, there could be the lab assistant, right? There could be the lab assistant who might be present over there, right? Along with that, program manager is present at the level of district hospital, but over here, as a surgeon is present, okay, who will be actually helping the surgeon in doing some kind of surgery, small procedures, right? There should be the OT technicians, right? So who will be assisting the case usually, right? OT technicians. So OT technician might also be there. Right? So these many people, so it is actually working at a bigger level, guys. It is working at a bigger level. Okay, so these many people actually you can expect over there. How many beds you can expect the CHC level? Usually we are expecting for about 30 beds. More than 30 beds might be there available, right? Okay, so if some patient is coming to you at the level of primary healthcare center, I'm talking about, you are MO in charge over there, you might be actually sending this patient, referring this patient to the community healthcare center, because specialists are also present over there, and over there we are talking about the more number of beds, right? Okay. Then after the CHC level, we are actually coming to the much bigger level. After the CHC level, we shall actually talk about the district level. Okay, this is the district hospital or the specialist hospitals, right? So here, let's talk about the fifth one, right? That is the district hospital. In the district hospital, obviously, we will be catering down much bigger level of population, right? More than 1.5 lakh number of people we might be catering over here, right? Okay. Then what people we are actually talking about over here? What kind of people actually working in this particular case? So over here, obviously, the specialist will be present over there, staff nurse will be there, medical officer would be there, and then all of these things will be there, which I have talked about in the CHC. Along with that, the program manager is also there. Okay, so they might ask you this. Along with that, program manager could also be there. Okay, so let's talk about the district hospital over here, right? Actually, we are talking about, in this case, we are talking about the medical officer might be present over there, right? Different different departments. I told you the dental doctor will be there, Ayush doctor will be there. You are MBBS doctor and you will be you will be MO over there. Then the specialist hospitals are also present over there. Staff nurses will be present over there. OT technicians will be present over there. Staff nurses, with their staff nurses, lab technicians might be there. Then the OT technicians might be there, and along with that, program manager might be there. Okay, so I'm program manager plus all of those features which I've talked about at the level of CHC, right? Plus CHC workers will be present over there. CHC workers, I mean all the doctors, nurses, okay, all of these things will be present over there, right? Okay, guys. Then how many beds? Actually, they are talking about the district level hospital, more than 80 beds. More than 80 beds, so it is having a bigger capacity, guys. Okay, depending on the so many factors, like how busy the hospital might be. Okay, some district hospitals might be so busy over there, depending on the population to population, right, which are actually visiting that hospital. So this is the thing which we are talking about at the level of district hospital. Now, again, guys, I told you that let me talk about some specialities of different kinds of workers. For example, at the village level, I told you that ASHA worker is working over there. So ASHA worker is catering to the population over there. How many people is the responsibility for one ASHA worker? I told you one village, and one village is carrying the 1,000 population, 1,000 number of people, right? Okay, guys, very nice. So now let's talk about the ASHA. Now let's talk about the ASHA. Okay. Yes. Now let's talk about the ASHA. Right? There was one song also, Choti Si ASHA. So ASHA over here basically is telling you that this is the accredited, okay, social health activists, right? This is the ASHA. Actually, if you talk about the ASHA, okay, ASHA is a very important component of our community at the basic level, that is a village level, right? So if the ASHA is working, best, or ASHA is working very fine at the level of the village level, right? So we can prevent so many of diseases in the community, right? So we can actually decrease the burden over the bigger hospitals and the at the level of PHC, at the level of CHC, district hospital, and some other tertiary care hospitals, right? So ASHA role is very crucial at the level of community, right? So if you talk about the ASHA, she should be in between around 25 to 45 years of age group, right? She should be 25 to 45 years old female, right? How many child she should be having? She should be having minimum one child, right? Minimum one child and maximum 2 children, not more than that. Okay, so if there is a female, okay, if she is not having any kind of child, she will not be the ASHA, right? And if she is having more than two children, then she will not be the ASHA, obviously, right? Because ASHA, if you talk about, I will talk about the feature, I will talk about the functions of the ASHA basically. Okay, what they are talking about, ASHA is actually going to home and home. They are providing the home visits, right? And they are actually trying to educate the people about about the so many roles over there, right? Providing so many of the care regarding the maternity health care and regarding the child health care, infant health care, neonates health care, right? Educating the people about their sex life and all of those things, right? So obviously, if they will not be actually having that particular quality, then obviously they will not be able to teach as well, right? Okay, so then what should be the qualification criteria? So at least she should be having 10th pass. She should be actually 10th pass, and with that she should be actually married in the same village which she is actually taking care of. Marriage should be happening in the same village, and she should be a permanent member of that village. She should be a permanent resident of the village, so that actually there is no problem with the communication part for the people living over there, right? Because if she will be member of that particular village or the resident of that particular village, so the communication will also be better among the people of the villages and the ASHA worker, right? So that is the case over here. Now, actually, once the ASHA worker will be appointed, right, she should be actually undergoing the induction training. So there would be the induction training. Okay, so she actually needs to undergo the induction training. Right? In this induction training, basically, we are talking about the initially there will be the class for 7 days, and then 4 sessions will be happening for 4 days, right? So initially there would be the 7 days classes, right? So initially there would be the 7 days, with that 4 sessions for 4 days, right? So in total it will be the 23 days induction training would be there for the ASHA worker, right? So that is very, very important, right? Once you're clear with that, actually it was developed by the NRHM and it was a success actually. So it was actually this concept of ASHA, okay, it was developed by the National Rural Health Mission, which we are talking about right now, right? So NRHM in 2005 year. Okay, so it might also be asked, right? So this is about the ASHA worker basically, and these are important features and the functions of the ASHA worker, right? Here also, let me talk about the ASHA worker features over here. So this is the ASHA, right? So this is the accredited social health activist. Okay, so it is actually chosen by and accountable to the panchayat, right? And what are the functions of the ASHA, guys? That is the advice rural health community regarding the health of the people over there, like regarding the immunization, regarding the antenatal care registration, regarding the institutional delivery, or regarding the contraception and the sanitation part, hygiene part, right? All of these things are responsibilities for the ASHA worker to communicate with the people and educate them, right? Then there could be the treatment for minor ailments like diarrhea, minor injuries and fever. Obviously in the induction training you will be telling them, right? Usually they are 10th pass, right? They are not having that much amount of knowledge, right? But obviously if we will be giving them training in such a level that they might be, you know, what should be the communication techniques should be there, what should be the qualities over there, right? How to communicate with the villagers, how to actually convince them about some kind of particular immunization and about the contraception and all of these things, right? Because this is very important role over there. And one of the very important role is, you know, we are actually targeting for the 60% of the contraception in the community, right? 60% of the contraception. So this is the ASHA worker kind of responsibility, and how well she is actually communicating with the people, that is also very crucial, because if she will be very good in the communicating quality over there to the villagers, right? And so obviously the better results will be coming out over there. So outcome will be better. So we want to actually achieve the 60% contraception or more than 60% contraception, because you know, if we will be able to give the contraception to the 60% of the population, and even 40% are actually having the intercourse and, you know, having the child and all, that 40% people will be actually giving to that much amount of children that we will be actually satisfying the needs of the population, right? So that's why 60% contraception should be there, and over there also you know, the role of ASHA is very important. So they could be accompanying the patient, for example, to the health facilities, delivering the dots, right, for the tuberculosis management and all, overall bridge between the ANM and the village, obviously, right? And it is actually depending on the ASHA worker only, that how many people are actually visiting to the primary health center, because they can actually significantly reduce the burden over other kind of departments, right? And facilitate the preparation and the implementation of the village healthcare plan and all, eye care and all. So these are all of the features and the functions of the ASHA worker, right? So ASHA worker is a very important component of our healthcare system, right? So that is very important over there, right? So it was a kind of a successful mission by the government side. So it is developed by the National Rural Health Mission in the 2005 year. Okay. Once we are clear with that, then I told you, if you guys remember, I told you at the level of sub-center, we are having multi-purpose worker. Okay. At the level of sub-center, we are having a multi-purpose worker. So let's talk about some salient features of the multi-purpose worker also. As we have talked about the ASHA like that, let's talk about the multi-purpose worker as well. MPW is multi-purpose worker, right? So having the different purposes over there, worker. Okay. So let's talk about the MPW or multi-purpose worker over there, right? Okay. So MPW worker, multi-purpose worker can be the female and can be the male, and having the different responsibilities. So let me just categorize these two. So MPW, there could be the male obviously, and MPW there are females also, and we have actually different works assigned to them, right? And what are the works of the male and the females? Usually they are asking you, right? How the question is coming, which of the following is not the work of the multi-purpose worker male? Which of the following is the work for the multi-purpose worker female? These kind of questions they are asking you, and they will be, whenever they are asking you multi-purpose worker, they will be always mentioning about the male or female. So that's why it is very important to know what are the functions of the male and what are the functions of female. Okay, because different functions are coming over there, and usually there could be the confusion. So that's why these functions should be known to us. So over here we are talking about multi-purpose worker male. I'm starting with that. So over here they will be actually taking care of national health programs, okay. Then they will be taking care of the malaria management and all, malaria slides, right, and surveillance of the malarial slides and all, right, in the area, right. Then there could be the RNTCP undertaken over here. I will talk about that, how this tuberculosis program is actually managing and all, right. In the tuberculosis segment, I will be talking about that. Then what about the expanded immunization programs? Expanded immunization program, right. About the leprosy follow-up cases, right. About the blindness cases or the blindness follow-up cases, right. And about the environmental sanitation, right. And about the environmental sanitation, right. So there could be so many features of the male purpose worker as far as multi-purpose worker as far as male is concerned. If you talk about this side, that is the multi-purpose worker female side, so obviously she will be actually taking care of, these are the females, so they will be good in what thing? Usually taking care of the maternal health and the children health, right. So maternal and child health services are coming under these multi-purpose worker females. So maternal and child health services, right. Then medical termination of pregnancy, detection of the non-communicable diseases, training of the DIE training. DIE means they are actually working that if the home-based delivery is happening, okay, usually the DIE role is over there, right. So they are actually trying to execute the delivery over there, right. Okay, so that training should be given by the multi-purpose worker female actually, right. They should be giving the treatment for minor diseases, minor ailments and all, right. We'll be training them, obviously we'll be giving them training for that, right. Along with that, universal immunization programs, right, they will be covering under these multi-purpose worker, male and female only, right. Universal immunization programs, right. Okay, so they are working at which level? Sub-center level, right. So that should be very, very clear. What will be your role if you are medical officer working over there, right? What will be your role? MO, that is the medical officer. You will be in charge over there, obviously. So you will be taking care of the things, that what things are actually happening, right? How the pharmacists are working and all of those things over there. So if you talk about the medical officer role over there, you will be actually seeing the OPDs, right? Obviously the patient will be coming to you. You need to actually providing the treatment to them. Then you would be the team leader over there. You would be the team leader, right? You should be able to perform small surgeries. For example, minor lacerated wounds are there and all of these things. So over there, you need to actually give the proper basic treatment to them. Okay, stabilizing those kind of patient, like you'll be giving the basic first aid to them. Suturing might be given to those patients, right? So suturing and all, you should be knowing these kind of skills, right? Then about the medical and the drug system, how it is happening, how these things are actually going on, medical and drug system, right? Okay, so these are some of the things which you need to know over there, right? Now, once we have talked about National Rural Health Mission, NRHM, that was launched, okay, way back over there. Then after that, the government saw that, okay, this was a successful mission. Then let's launch one more mission, that is for the urban population, right? That is the National Urban Health Mission, right? So once we have talked about the NRHM, National Rural Health Mission, now let's move on to the NUHM, guys. That is the National Urban Health Mission. National Urban Health Mission. Okay, so I hope we have talked about details of the NRHM, and I hope you were able to understand that. Now we are moving on to the one more topic, that is the National Urban Health Mission, right? In this National Urban Health Mission, basically we are talking about the divisions, subdivisions, and the how many houses actually we are catering to, right? So let's talk about that particular basic broad classification, and now then we will be actually moving further, right? So in this particular case, we are actually talking about what are the divisions. For example, I told you at the village level, we are having first of all village like in the National Rural Health Mission, what I told you, first of all, we were having the village, then we were having the sub-center. After the sub-center, we were having the primary healthcare center, then the community healthcare center, and then we were having the district hospitals and all. How the division hospitals are actually working over there, let's talk about that as well, right? So like in the National Rural Health Mission, we were having the ASHA. Over here in the urban population also, we are having the ASHA, but this time we'll be calling this ASHA as urban ASHA, right? So divisions over there are present over there. How many population we are actually catering to, that is also important, because sometimes questions are coming that how many population will be catering this department, or urban ASHA will be catering to how many people, or let's say the urban CSC will be catering to how many people. So these are some of the questions might be coming over there, right? And number of houses which they are catering to, right? Okay, so let's talk about this particular thing also, because so many MCQs might be hidden over there. So in the divisions part, guys, in the divisions part, we are actually talking about, first of all, at the basic level, the village level, ASHA was working in the NRHM. Here also, ASHA is working at this particular urban level. So here we'll be calling them as urban ASHA. After the urban ASHA, after the village, I told you there was sub-center. Here also there is sub-center, right? And we'll be calling them as A&M center. Okay, so A&M is working at the level of center. I told you A&M and the multipurpose worker, they were working at the level of sub-center. So here A&M center, right? Then we are having, after this we were having the PSC. After the sub-center we were having the PSC, and then CSC, and then district hospital. Here also same thing. So here we are talking about the urban level, so urban PHC. Then we are having the urban CHC, right? And after the urban CHC we are having the district hospital. That will be the same, that is the district hospital, right? We just need to know about some of the population part over there. So for example, for the urban ASHA, if we talk about, they are actually taking care of some bigger level, somewhat bigger level. So 1000 to 2500 people usually they are catering to. 1000 to 2500 people they are usually catering to, right? Usually we are considering that one house will be carrying the 5 members. Okay, so you just need to divide it by 5 and you will be getting the number of houses they might be catering to. So how many houses they should be visiting over there? So 200 to 500 houses. Okay, so they might be catering to around 200 to 500 houses, right? If you talk about the A&M center, okay, they might be actually catering to 10,000 number of people, and if you will be dividing it to the 5, okay, they will be around 2,000 houses they will be catering to. Urban PSC, actually they are talking about 50,000 number of people, right? And how many houses? 10,000 people, 10,000 houses, right? Urban CSC, it is much bigger level as compared to the PSC sub-center and all of these things. So obviously bigger number of population they will be catering to, around 2,50,000 people, and around 50,000 houses will be covered under it, right? At the level of urban level, right? And in the district hospital, we are talking about more than 5 lakh population, where we shall talk about more than around 1 lakh houses will be covered over there, right? So this is about the urban level. So once you will be understanding about the National Rural Health Mission, then it will be very easy to understand the National Urban Health Mission. Same things are there, but just we are adding the urban name over there, and the number of houses, number of population will be increasing in the urban level, right? So then they have introduced the National Health Mission, guys. National Health Mission. Actually, it is nothing only. It was actually introduced at the same time when they have announced this National Urban Health Mission. At the same time only they have announced the National Health Mission only. National Health Mission is nothing, but they said that it is actually combination of both National Rural Health Mission plus National Urban Health Mission. National Rural Health Mission plus National Urban Health Mission. They are making up one mission, that is the National Health Mission. And usually it is a success, right? Because at the lower level, if you're working very fine, then obviously you are decreasing the burden at the upper levels, right? So that is the thing, and that's how our Indian healthcare system is working as well. Okay, so that is the thing. Now we are coming to a very interesting topic, one more very interesting topic, that is the Integrated Child Development Services, that is the ICDS, right? In this ICDS, so let's talk about the ICDS now. This is the International Child Development Services, right? International Child Development Services, ICDS, right? And this is the logo for the ICDS which you are seeing right now in the front of your screen, this is the ICDS, right? This is a symbol which shall be asked in your exams, right? So this is the ICDS, International Child Development Services. Here this service was actually launched in 1975, right? This was launched in 1975, and it is actually coming under which ministry? This actually comes under Ministry of Women and Child Development. Ministry of Women and Child Development, right? So very important. Sometimes these kind of factual data might be tested. Child development. Okay. Now, if we talk about this particular thing, International Child Development Services, they are talking about the Anganwadi workers, right? Anganwadi workers. So let me talk about again, guys, same things that we had talked about, NRHM and the NUHM. Okay, over here also you might be writing that here is the division, and here you might write the population over here, right? Okay, so division the population. So here actually we are talking about three important people, right? One is the Anganwadi. At the basic level, Anganwadis are working. So Anganwadi, okay, obviously you might have heard about this Anganwadi, right? Then there are the Anganwadi supervisor. There is an Anganwadi, then there is an Anganwadi supervisor, and above the Anganwadi supervisor there is a child development program officer, right? So Anganwadi, then there could be the Anganwadi supervisor, right? And then there could be the CDPO. CDPO is the child development, right? Child development program officer, right? So child development program officer, right? So obviously Anganwadi people will be catering to some population, Anganwadi supervisor also, and the CDPO officer also. Anganwadi, they are actually taking care of around 300 to 800 people, and these are your MCQs, guys, right? Anganwadi supervisor will be catering for around bigger level of people, that is the 25,000 people, right? And CDPO, obviously they will be carrying much bigger population, that is the around 1 lakh population, right? They will be catering to for around 1 lakh population, right? So that is about the ICDS basically. Then let me talk about the Rogi Kalyan Samiti. Okay, remember in the initial part I had mentioned about the Rogi Kalyan Samiti, right? So Rogi Kalyan Samiti. Rogi Kalyan Samiti, basically they are talking about the health infrastructure. So what component they are talking about? Very briefly, let me talk about that. So they are talking about the health infrastructure, right? With that, they are talking about the involvement of the community. Remember I was talking about the primary healthcare components, where I have told you, yeah, the principles of the primary healthcare I told you in the community participation. You should remember the Rogi Kalyan Samiti. So Rogi Kalyan Samiti is actually talking about the participation of the community, right? Participation of the community. So that is a Rogi Kalyan Samiti. So now look over here. So Rogi Kalyan Samiti, actually they are talking about the health infrastructure. They are talking about the community participation, right? Community participation, right? It is working at different levels. For example, it is working at the CHC level. It is working at the PHC level also. So CHC level and the PHC level, okay, they are working at this particular level, right? Fine. Now, once you have talked about that, there is one more Samiti over there. This is called as the Mahila Arogya Samiti. So let's talk about that Samiti also. So this is the Mahila Arogya Samiti, right? In the Mahila Arogya Samiti, basically they said that these are the collection of females actually from the specialized departments, and they are actually working for the betterment of the healthcare system. Okay, mainly for the betterment of the female healthcare system, I will tell you. I will tell actually, because these are the females which are actually governing this category. That's how the name is also. That this is the Mahila Arogya Samiti. In the Mahila Arogya Samiti, this is the collection of females from the rural areas and the urban areas. So collection of females, right? Collection of females from urban and the rural areas. Right? And they are actually talking about the growth. They are actually helping us, helping the community in the growing of the maternal healthcare and the development of the child healthcare, right? So helps in growth or development of child basically, right? Okay, then they're actually working at which level? They are actually working at the village level or the sub-center level, right? I told you that Rogi Kalyan Samiti was working at which level? They were working at the CHC level, PHC level. and here I am talking about some lower level, that is your, so working at around at the village level or sub center level, right? So Rogi Kalyan Samiti, CHCPSC, they are working at that level, and below that we are having this Mahila Arogya Samiti, right? Okay. Now, what is IHPS? Okay, so one more term over here. What is IHPS? Right? Basically, this is the IHPS or IPHS. Right? This is the Indian Public Health Standards. Indian Public Health Standards. Indian Public Health Standards, right? In the IHPS, basically, there are different categories. In the IHPS, for example, we are talking about the government hospitals. Basically, they are talking about the IPHs. They are actually following this Indian Public Health Standards. And if you talk about the corporate hospitals, then they are following the NABH. If you talk about some multi-specialty hospitals over there, then they are actually following the JCI, that is a Joint Commission International, right? So government hospitals, if you talk about over here, government hospitals follows the protocols of IPHS, right? If you talk about the corporate hospitals, they will be following the protocols of NABH, right? Follows NABH. And you might know that if you're working in some if you're working in some corporate hospital, so this is basically the NABH, okay, National Accreditation of Board and Hospital, right? So NABH, they will be actually following that. And some multi-specialty hospitals, they might be following, right? They might be following the JCI, right? Joint Commission International, right? So this is the Indian Public Health Standard, and these kind of hospitals must be following these kind of standards, right? So there could be different standards for the different categories, right? Okay, so once we have talked about that, let me talk about some sub-centers over there. Okay, so we have talked about the ASHA worker, we have talked about the multi-purpose worker, okay, we have talked about the National Rural Health Mission, National Urban Health Mission, right over there, and we had talk about the ICDS, International Child Development Services, right? ICDS, that is the International Child Development Services. And then we are actually moving on to the sub-center. Actually, there are type A and type B sub-center, right? That is the thing. At the level of sub-center, if I am talking about, sometimes I ask you these questions, that there could be the type A sub-center, and there could be the type B sub-center. At the level of type A sub-center, okay, how many deliveries or how many number of children birth might be there? There could be no or minimal delivery. So once they had asked you how many deliveries might be happening, no or minimal delivery, right? So over here, how many beds you are actually expecting over here? There are only 0 to 1 bed. 0 to 1 bed. If we talk about type B sub-center, right, this is a bigger level. Over here, we shall expect some of the deliveries, 20 delivery per month. Okay, and over here, how many beds we are expecting? That is around 2 to 4 beds. Right, that is around 2 to 4 beds, right? Now, if we talk about the PHCs, guys, like that, right, however, we have talked about that. So if you talk about the PHCs, guys, here we might be having type A PHC, then type B PHC, and then high load PHC, where the number of people are more, right? At the level of type A PHC, we are saying that it could be 20 deliveries, less than 20 delivery per month. And the type B kind of PHC, there could be more than 20 delivery per month, right? And at the level of high load PHC, there could be more than 50 deliveries per month. 50 deliveries per month, right? So there could be the criteria of this one, right? Next point over here is that after this one, we shall talk about the National Health Mission components. In itself, National Health Mission component says that there should be the efficiency in the system, right? There should be the effectivity of the system. There should be the equality and the equity of the system, right? So every people must be having the equal rights for getting the same kind of treatment. Okay, that I have told you the previously as well, right? Then what is the Ayushman Bharat scheme? What is Ayushman Bharat scheme? Okay, that is also very important. Ayushman Bharat scheme is actually talking about two important components over here, two important sectors over here. So what are these two important sectors which are covering under the Ayushman Bharat scheme? The two sectors are actually, one is the Pradhan Mantri Jan Arogya, PM Jan Arogya Yojana, right? Here is the logo of the PM Jan Arogya Yojana, right? Here what you are seeing, that is the Pradhan Mantri Jan Arogya Yojana, right? So this logo might be asked over there, PM Jai, this is the Ayushman Bharat logo, okay? This logo might be asked, very, very important for the exams purpose. So PM Jan Arogya Yojana. Second one which we are having, that is the comprehensive primary health care, right? Comprehensive primary health care. Comprehensive primary healthcare. Okay, by the way guys, this is the logo for the National Health Mission. This is the logo for the National Health Mission, right? Just adding over here. Okay, so NHM, which is carrying the NRHM plus NUHM, that is the National Health Mission, right? So this National Health Mission is actually talking about, this is the logo for the National Health Mission. Okay, please remember that as well, right? Okay guys, because logo also, you know, image based questions are actually very frequently asked these days. Okay guys, so comprehensive primary healthcare, actually they are talking about the health and wellness centers. Health and wellness centers. So they are talking about what? They are talking about the health and wellness center. In the health and wellness center, they are talking about the community health officer, CHO, right? So CHO post, that is the nurse, basically they are working for the betterment of the healthcare, right? CHO, they will be posting in the different centers, right? Sub centers for an example. So CHO, then there could be the multi-purpose worker, right? They are actually selected under this particular scheme, Ayushman Bharat scheme from the government side, and sub centers which are actually upgrading to the health and wellness center under this scheme only. Health and wellness center. Okay, so this is the scheme which they are actually talking about in this particular case, right? At last, before ending this topic, okay, let me talk about what different workers are catering to how many populations basically. Okay, so that might be asked very commonly. Okay, so now let me talk about that. What are the different norms for the healthcare personnel, right? Norms for healthcare personnel, because these questions are asked very, very frequently, which I have observed these days. So over here, if you're talking about the nurses, guys, we shall talk about how many people are, for example, nurses. Okay, we shall talk about the health workers, right? There could be the male or there could be the female, right? Then we shall talk about the trained dye. Trained dye, by the way, I told you they should be trained by multi-purpose worker, female, right? Then there could be the pharmacist, right? These are the very basic important components of our system, right? Then there could be the lab technicians, right? So everybody is having different roles basically. Asha, I told you already, 1,000 people over there, and the doctor. Okay, how many people they should be catering to? So guys, over here, if you talk about the nurses, then basically 1 per 5,000 population, right? They should be catering to around 1 per 5,000 population, right? If they are catering more than 5,000, then they are overburdened, and if they are catering less than 5,000 in some area, then they could be underburdened, right? Okay, if you talk about the health workers, basically in the plain areas 1 per 5,000, in the tribal areas 1 per 3,000. So 1 per 5,000 in the plain areas, and 1 per 3,000 population in the rural areas. Okay, if you talk about the trained dye, then around obviously 1 per village which is having the 1,000 people. Okay, if you talk about the pharmacist, they are actually 1 per 10,000 people or 1 per 10,000 population. If you talk about the lab technicians, same 1 per 10,000 people. If you talk about the ASHA worker, I told you 1 per village, that is 1,000 people, right, or population. If you talk about the doctor, that is also same 1 per 1,000 people. Okay, health worker, if you talk about, okay, for the rural areas it is around 100. Okay, it is 100. Please correct that. That is around 100 people, right? Okay, guys. So that was about the basically, healthcare system of India. We have talked about the National Rural Health Mission, National Urban Health Mission. That is actually basically making the National Health Mission. We have talked about the Integrated Child Development Services (ICDS). Then we have talked about the norms in the healthcare personnel, and we have talked about the different sub centers and the primary health center. Okay, and all of these things, and what are the roles of the different centers. For example, sub center, and what is the role of the ASHA worker, and all of these things, right? So I hope you enjoyed the session. Okay, please do revise, and I will see you in the next one. Thank you.